Hi, my name is Nancy Bartlett. I'm a family nurse practitioner student at United States University. Today is November 30th, 2025, and I am here to do a recorded cardiovascular and lung and thorax exam. For transparency, I'm going to do a quick 360 of the room. And the ceiling. And the floor. And I'm gonna put you down right about here. So like I said, we are here for a cardiovascular and thoracic exam that is going to be recorded and uploaded to YouTube for educational and grading purposes. Do I have your verbal consent?
Yes.
Great. And for educational purposes, could I please have your initials?
JB.
Great. And how would you prefer I refer to you as?
Jamie.
Okay, Jamie. During this exam, should you have any questions or concerns or experience any kind of discomfort, please let me know, okay?
Yes.
Okay, great. The first thing we're going to do is we're going to get started with the cardiovascular exam. I'm going to inspect the anterior chest and the anterior chest. If you don't mind putting your arms down and standing up for me. Great, perfect. The chest is symmetrical. I don't see any heaves, lifts, no scarring, and no deformities noted. The next thing I'm going to do is I'm going to palpate, and I'm going to begin at the second intercostal space, the aortic on the right, the second intercostal space on the left, the pulmonic, the third intercostal space, Erb's point, the fourth intercostal space, which is the tricuspid, and then the fifth intercostal space, which is the mitral, and I'm going to do it again. So I don't feel any heaves, lifts, or abnormal pulsations. The next thing I want to do is palpate the point of maximal impulse, which is located again at that fifth intercostal mid-clavicular line. And that is present, and it is normal amplitude and duration. The next thing that I would like to do is assess his jugular vein distension, and for educational purposes I'm not going to have him recline all the way, but he would recline to a 30 to 45 degree angle. I'm going to have you turn to the left and to the right, and no jugular vein distension noted. Next, I'm going to assess the carotids. I'm going to use the bell of my stethoscope, and I'm going to listen for any bruits. And no bruits noted. Next, I'm going to palpate those carotids one at a time. And those carotids are strong and equal bilaterally. The next thing I'm going to do is I am going to palpate pulses. I'm going to start with radial, brachial, and for educational purposes, I'm going to have him put his feet up here just so you can see through the camera. Dorsal pedis, and posttibular, posterior tibula, which are all strong, equal, and +2 bilaterally. Next, I'm going to oscillate heart sounds. I'm going to use the diaphragm. And again, I'm going to start at the aortic, which is at the right second intercostal space, pulmonic, which is at the left second intercostal space, Erb's point, which is at the right third intercostal space, tricuspid, which is at the right fourth intercostal space, and mitral, which is at the 5th intercostal midclavicular line. S1 and S2 are present with regular rate and rhythm. I don't appreciate any murmurs, rubs, or extra heart sounds. I'm going to oscillate again, but this time I'm going to use the bell, and this time what I'm listening for any kind of murmurs. So again, at the aortic, the pulmonary, Erb's point, tricuspid, and mitral. And I don't appreciate any murmurs. However, if there were a murmur, I would also want to record the timing, grade, pitch, radiation, and location. Next, I'm just going to take a look at his lower extremities. And again, for educational purposes, I'm just going to have him prop his legs right back up here again. And we're looking at his legs, and I don't see or appreciate any kind of swelling or edema. However, if I did note edema, I would want to note if it was pitting or non-pitting, and if it was pitting, I would want to grade that pitting. Also want to assess for capillary refill on all toes and all fingers. And capillary refill is less than 2 seconds on fingers and toes bilaterally, which is a normal finding. I also want to look at his skin color, which is normal for ethnicity. His skin is warm, dry, it's intact. I don't note any cyanosis or varicosities. And that does complete our cardiovascular exam. So now I'm just going to have Jamie come and sit right here. And we're going to begin the lung and thorax exam. The first thing that I want to do, and I'm just going to turn the camera just a little bit to get us more in line, is I just want to inspect the chest. I'm inspecting anteriorly and posteriorly. And the chest is symmetrical with normal rise and fall. I don't see any use of accessory muscles or any kind of retractions. The anterior to posterior diameter appears normal at 1 to 2. The next thing I want to do is palpate, and I'm just going to palpate. And Jamie, you tell me if you have any tenderness anywhere. Any tenderness? No. So no tenderness, no masses, and no deformities noted anywhere. The next thing I want to do is assess for chest expansion. So I'm just going to use my hands on the posterior part of the back. And Jamie, take a breath for me. And out. And one more. Great. So it's symmetrical and even bilaterally. Next, I'm going to test for tactile fremitus. So I'm going to have you cross your arms in front of you, and anytime I place my hands in your back, I want you to say 99. Ready?
99, 99, 99, 99, 99.
Perfect. So vibrations are equal bilaterally. I don't feel any increase or decrease in fremitus, which is a normal finding. I'm going to percuss the posterior portion of the chest. And resonance is equal through all lung fields posteriorly. Next, I'm going to assess lung sounds, oscillate lung sounds, and I'm going to use the diaphragm, and I'm going to begin in the right upper lobe. So when you feel my stethoscope touch, will you please take a nice deep breath for me? And that's the right upper lobe. And left upper lobe, right lower lobe, left lower lobe, right middle lobe, left lower lateral lobe, coming around to the anterior portion, right upper lobe, left upper lobe, and so all lung fields are clear bilaterally. I don't hear any wheezing, bronchi, crackles, or stridor. I also want to take a look at your hands, and I don't see any cyanosis. I don't see any clubbing of the fingers. Looks good. So that's a normal finding for a lung and thorax exam. Thank you so much.